This is a very, very bipartisan piece of legislation in its various forms. Autism knows no political boundaries, Democrat, Republican, or independent, and it is an exponentially increasing epidemic in our state. We've gone from 1 in 10,000 in incidents in the 1980s to 1 in 150. And of the many mandates that are on the books, autism is one of 12 neurological disorders and is the only one that is excluded from health insurance coverage. And we believe it is imperative that we take the steps and follow the lead of other states that have mandated insurance coverage for the diagnosis and treatment of autism to help these children and families improve their outcomes. And in doing so, we will actually reduce costs longitudinally for the providers and the costs for those families. And we believe this is an emerging civil rights issue of this day. And I believe it's outrageous that families would be denied coverage only because their children have been diagnosed with autism spectrum disorder in its various forms. And so I'm very thankful for the bipartisan support we have on both sides of the aisle. You know, I'll just point out that even those in the insurance industry have admitted privately that they know this is the right thing to do. The research shows, and the practice of other states that have done this shows, that it only increases costs for premiums anywhere from 1/2 to only 1%.
The insurance industry will need a mandate because it is a competitive disadvantage to offer a benefit that marginally raises the cost of your premiums. It's a competitive disadvantage. And all the other states have passed mandate legislation. That's correct.
And our legislation is modeled after other states that have done so.
You need to understand that out of the 12 major neurologic disorders, traumatic brain injury, cerebral palsy, Alzheimer's disease, Parkinson's disease, this autism spectrum disorder is the only one that's not covered by insurance, only one of the neurologic conditions, and it stands out. It stands out, and it has a huge impact on families in Missouri.
You know, in terms of those of us that are not with a child with autism, again, it's going to mean a cost increase in premiums of perhaps 1/2 of 1% to 1%. For the families that do benefit from that to receive the health care services and coverage in terms of everything from diagnosis and early assessment to treatment to speech therapy to ABA, applied behavioral analysis that is so effective, it's going to mean the world. It is going to be a whole new world of opportunity for these children and these families, and it is so critical that we end the discrimination against people with autism and their families, because the exclusion is atypical of other areas of coverage.
Harry was diagnosed with autism at the age of 2. We were lucky to get him at 2 because then we did get First Steps, and First Steps ends at 3. Lots of these kids don't get diagnosed until after 3. First Steps is not there, so automatically they're already starting a little late. However, our neurologist had said, I'm happy to tell you he has autism. I said, happy? And she goes, 10 years ago, he would probably have been diagnosed MR. And your services of ABA, RDI, speech, OT, anything that, I'm writing down here for you, wouldn't be provided. And by the time he's age, pre-teens, teens, the route was to an institute. So I said, okay, I guess we are lucky.
It's a great investment to make, to invest in the education of a child who has a chance at a normal and productive life, who otherwise would be a candidate for being institutionalized in their late preteen years. This is a great investment to make for these kids so they can give back to society and have meaningful and productive life, and it's the morally right thing to do to take care of our most vulnerable citizens.
I'd like to have Bobby Mosley, the mother of a child with autism, answer that question as well.
I was one of the parents a long time ago that was told that my daughter needed to be institutionalized, and that if we wanted services to move out of the state of Missouri, because my daughter was able to get the supports, my daughter now goes to college. She now lives in a home of her own. She is able to transport herself around the city of Springfield on the bus. And as I said in the hearing today, she went to apply for her first part-time job. That saves the state money. She is a tax-paying citizen. she pays back into the system that gave her a chance in the beginning. That's all that all of us parents want, is to have our children to be as independent as possible and to be tax-paying and voting citizens. That's it.